Are you prepping for the NCLEX? Well, let's walk through some key questions that you'll need to know. And if you want a ton of questions with rationales for free, simply click the link in the description below to create your free Simple Nursing NCLEX account. Let's walk through this case study, and always remember to highlight the key terms that risk safety. So starting at the top. Step number 1, read the intro and think safety. Simply think of 3 things that will kill or harm the school-age client with changes in behavior. So number 1, we have to think ADD or ADHD. Now, it's not going to kill the kid, but it might harm them. Number 2 could be anxiety, and even 3, learning disorders. Now, step number 2, look at the tabs and mentally highlight any keyword that risks safety. So let's click over to tab number 2 in the nursing notes. Well, in the initial visit, the child does not listen or seems distracted. Also, they demonstrate daredevil behavior and refuses to follow the rules. Man, that sounds a lot like me. And they also struggle to sit in their seat. Okay, definitely me. The next thing is they need constant reminders to take turns and not to interrupt. Also, the child has excellent appetite, but no weight gain. All right, I definitely wish I had that. And sleeping patterns are off, and the little kid fidgets, and also needs questions repeated. So I'm definitely suspecting ADHD. Now let's look at the 3-month follow-up from the initial visit. The child is now receiving methylphenidate medication to manage ADHD. Now, the key term here is not interested in eating, so this is a negative change. Previously, we had an excellent appetite, so it's probably related to medication. Also, the kid spends hours every single night trying to get ready for school the very next day. And here's a key word, not sleeping. The ADHD meds might be causing insomnia. Now, all these findings show a much-needed dose adjustment in the ADHD medications because of the continued behavior issues, but not causing weight loss or insomnia. Now, at the 6-month follow-up from the initial visit, after the dose of methylphenidate was reduced about 6 weeks ago, we do see an overall improvement, but some concerning findings. The parent struggles to get him to eat the recommended food choices, so a possible referral to the nutritionist is needed. Now let's click over to tab number 3. We see a weight loss of half a pound, down from 41.5 pounds at the 3-month follow-up to 41 pounds at the 6-month follow-up. All right, now for step number 3 here. We have to find those key words before looking at each item for each question. All right, now that we found all the key terms that risk safety, you can now go through each item more confidently when answering specific questions. So remember, don't be scared, be prepared. Simply find each key word that risks safety before jumping into the question. This question is asking us to select 7 assessment findings that require follow-up by the nurse. The problem is we have a 5-year-old with those behavioral changes. So for the solution, before looking at the options, simply think about behavioral issues in children. And always think about safety first. So number 1, impulsivity. Acting without considerations of the consequences can be harmful and can even kill the child. Also, behavioral issues can often indicate underlying issues like ADHD, learning disorders, or even potential abuse or neglect. Now let's look at the assessment findings. So option 1 is correct. Impulsivity, reacting without the consideration of consequences. Huge risk for safety and even injury. The next option is incorrect because being very active is a normal finding for a child. Now the next option, easily distracted. This requires additional follow-up because it could be indicative of ADHD or another learning disorder. Now the next one here is really weird. Participating in sports. This is actually a positive finding that does not require follow-up. The next one here is frequently interrupts others, a common finding associated with ADHD. So we definitely need to follow up. What about difficulty waiting his turn? Well, this indicates a struggle to understand and follow social rules. So again, another indication of ADHD. How about weight that is stable over the past 6 months? Well, yes, we have to follow up and evaluate why the child is not gaining weight. How about socializing with friends in the neighborhood? No, that's completely normal behavior for a child. What about issues following the rules at home and in the classroom? Well, yes, difficulty with structure and authority could indicate behavioral disorders. What about the last one here? Difficulty with both time management and task completion. Yes, another indicator of ADHD. Okay, now on to the matrix questions. That was weird. It's probably a glitch in the matrix. This question's asking, for each finding, click to specify if the data indicates expected growth and development or unexpected growth and development. The problem here is we have a 5-year-old and we're monitoring for growth and development. So for the solution, before looking at the options, think about expected growth and development for a 5-year-old. Well, number one, expected growth is 2 to 3 inches and gaining about 4 to 7 pounds per year. And a milestone to consider is the child skips with good balance, socially engaged, and is supposed to follow the rules and even pretend by make-believe. Now let's look at the findings and see if it's expected or unexpected. So, physical activity. Well, yes, this is expected for the age of the child. What about socially engaged? Well, yes, this is consistent with normal growth and development. How about participating in sports? Of course, all kids love to participate in sports. Now, the next one is interesting. Consistently very impatient with others. Well, believe it or not, this is unexpected. They should be generally patient with others. How about requires frequent redirection? Now, that one is totally unexpected. They should be able to focus on a task without repeated redirection. What about excellent appetite with no weight gain? No, completely unexpected. We would expect a weight gain of 4 to 7 pounds per year. How about 1-inch increase in height in about 6 months? So this is normal, and it tracks normal growth and development. How about the next option? Difficulty following rules even after being reminded of them. Well, believe it or not, this is unexpected. They should be able to follow the rules with only occasional reminders. And the last option, difficulty with time management leading to inability to complete small tasks. Well, this is a classic example of ADHD. So this one is unexpected. They should be able to complete small tasks easily. This question is asking us to complete the following sentence by choosing from the list of options. The problem here is the highest risk related to behavioral changes. So for the solution, before looking at the options, what do you know that can harm or kill related to behavioral changes? Well, number one is impulsivity, acting without considering the consequences, huge risk for injury. And behavioral changes can also indicate potential harmful environments, for example, abuse or even neglect. Now let's look at the actual question. The child is the highest risk for blank, as evidenced by blank. So the best choice for the condition is injury, because the child acts without considering consequences, which can be very harmful and even kill the child. Now, the rest of the options are incorrect because anorexia is not supported by any of the clinical data. Neither is isolation. There's no evidence of isolation. The kid attends school and interacts with family. So this highest risk for injury is evidenced by blank. Would it be appetite? Well, no. Parent and child reports excellent appetite. Would it be the next option, impulsivity? Yes, the child ran into the parking lot without looking, so a huge risk for safety. And so the last option is incorrect because social engagement is not apparent here. The child plays with his brother. In this question, it's asking which intervention should the nurse include in the client's nursing plan of care. Select all that apply, our favorite questions. The problem here is developing a care plan for ADHD. So for the solution, before looking at the options, think about safety here. So number one, increased risk for injury. So we have to monitor closely and minimize hazards. Number two is offer distractions for aggressive behavior. For example, blowing up a balloon. And the last one here is given written schedule for daily activities. Now let's look at the options here. So option one is correct. Encourage the parents to set clear, consistent limits with the child. Clear, consistent limits provide structure and helps the child understand expectations. The next option is also correct. Recommend the implementation of an instructional educational plan. This helps to meet individual needs related to learning and education. Also, option 3 is correct. Establish consequences for inappropriate behavior. It helps the child recognize actions will relate to consequences. And in option 4, also correct, monitor height and weight closely. Because remember, medications for ADHD can suppress appetite, and the child is already not gaining weight. Option 5 is also correct, so we're on a roll here. Suggest parents gain their child's attention and verbally explain the daily schedule. This helps the child comprehend expectations for specific, short periods of time. Now, the only one wrong here is the last option, and let me explain why. Provide information to parents regarding the child's need for a lifetime pharmacotherapy. No, not all children with ADHD require lifelong pharmacotherapy, or basically lifelong drugs. All right, let's keep this review going with another question. In this question, we have to click to highlight the orders that require clarification by the nurse. The problem is orders at 3-month follow-up for ADHD. So for the solution, before looking at the options, simply review the findings in the nursing notes. So number 1, the child is not interested in eating, but previously had an excellent appetite. And number 2, the child's not sleepy, which ADHD medications can actually suppress appetite and cause insomnia. So now let's highlight what is concerning. Number 1 is the increase in methylphenidate dose to 7.5 milligrams twice a day. No, we don't want to do this. We're already seeing poor appetite and insomnia, which means the dose should be decreased. The next thing we're highlighting is a consult for a physical therapist. Now, this is completely unneeded or basically unwarranted because there's no issue with physical mobility. This question is asking, for each finding, click to specify if the data indicates the child's condition has improved or declined. The problem here is the follow-up after behavioral therapy referral and medication dose adjustment for ADHD. So for the solution, before looking at the options, consider each finding if it's getting better or worse. So for example, the appetite should increase and the child should be able to sleep at night. So now let's look at the options here. Let's look at what's improved. Inattention, has that improved? Well, parents report improvement, so that's a good thing. What about hyperactivity? Well, it's better according to the parents, so this one is improved. What about impulsiveness? Well, this one's improved as well, because no dangerous behavior is reported recently. What about sleeping patterns? Well, again, also improved. Previously, the child had insomnia, and now they sleep around 8 to 10 hours per night. Now, the last two is shown as declined, kind of like my credit card during nursing school. Because nutritional intake is declined, the child is eating less often because they do not like the food recommended by the nutritionist. And for growth and development, we actually see a weight loss of half a pound. So that is not improved, it's actually declined. Drag and drop questions don't have to be such a drag. See what I did there? Check this out. This question is asking us to drag words from the choices below to fill in each blank in the following sentence. The problem here is ODD, oppositional defiant disorder. So basically defiance, going against the grain here. So for the solution, before looking at the options, what do you know about ODD? Well, number 1, childhood mental health disorder is diagnosed before 8 years of age, and frequent ongoing patterns of defiance and anger toward authority. Also, this includes vindictiveness, basically seeking revenge. Now let's break down the actual question. The nurse should recognize the risk factors for ODD are blank, blank, and blank. So let's look for the word choices. Is it going to be large families? Well, family size is not a risk factor for ODD. What about parenting issues? Yes, of course. Abuse and neglect, even inconsistent parental discipline and lack of supervision is a risk for ODD. What about family issues? Well, yes, unstable relationships within the family unit can actually increase the risk for ODD. Now, the next one is incorrect. Immune deficiencies. There's no known relationships between ODD and immune deficiencies, as well as depression. Even though depression may coexist with ODD, it's not known to cause ODD. And the last one is correct. Environmental factors, because problems in the home or even the educational environment can increase the risk for ODD. This question is asking, for each client below, click to specify the potential nursing actions to decrease the risk for injury. Each client may support more than one action. The problem here is the risk for injury with a client with mental health disorders. So for the solution, before looking at the options, think about safety and consider injury risks for clients with mental health disorders. So number 1, bipolar disorders. These clients go from mania, extreme energy, down to depression. So we have to have a controlled environment with minimal stimuli. Also, the next client could be suicidal ideations, so constant supervision is needed. And the last one here is schizophrenia, that's scrambling inside the head. Clients experience psychosis, so giving medications as needed to reduce fear. So now let's look at the assigned clients and the potential nursing actions associated with them. First up is bipolar disorder experiencing mania, where they act like a maniac with high energy. So first, would we encourage the client to attend group therapy? No, this client has way too much energy, so they're not appropriate for group therapy. What about ensuring that the client does not go outdoors? Yes, this promotes safety through a controlled internal environment. How about providing carbonated drinks or even coffee 4 times a day? Oh my gosh, that's way too many stimulants for this client already experiencing mania. Okay, now what about the next client? A client with major depressive disorder experiencing suicidal ideations. Are we going to remove all shoelaces from the client's shoes? Yes, of course. This helps prevent objects from being used for self-harm like suicide. What about the next one? Schedule a sitter for the client. Of course. Supervision provides safety, especially if the client is on a suicide watch. And the next one here, administers soft wrist restraints when the client speaks of suicide. No, on the NCLEX, we never want to use restraints. And if we have to, it's only as a last resort. So just try to steer clear of restraints. Now, the next client is schizophrenia, experiencing psychosis. So do we want to keep them in the room with lights on during nap time to reduce shadows? Well, yes, this is correct. Exaggerated fear with hallucinations because shadows can induce fear. So we want to use lighting to limit that. How about the next one? Apply leather restraints during psychotic episodes. No, this could cause harm. Remember, on the NCLEX, we never really want to use restraints. What about administering a benzodiazepine to decrease that anxiety? Yes, that is the correct thing to do because, again, it helps to decrease anxiety and also reduce psychosis. In this question, they're asking for each finding below, click to specify if it indicates anxiety, moderate depression, or even mania. And each finding may support more than one condition. The problem here is we need to differentiate between the similarities and differences between functional anxiety, moderate depression, and mania. So for the solution, before looking at the options, think about what you know about anxiety. Well, with anxiety, there's a lot of panic, right? What about moderate depression? Well, depression, let the name help you. We have a depressed mood. And mania. For mania, simply think maniac. High energy and all over the place. All right, now let's look at the findings and relate it back to the specific diagnosis here. So the first finding is excessive sleep. This would be for moderate depression. So again, let the name help you. Depression, we have a low and slow mood. So this would affect sleep. How about the next one? Feeling jittery. Well, remember, jitteriness is a sense of nervousness. So high functioning with anxiety, the client may feel jittery or even nervous. We would also see this in mania with major energy. The client would have racing thoughts and fast talking, even nervous energy. What about risk-taking behavior? Simply think, for mania, the client acts like a maniac. So we have to check the box for mania. Okay, the next one is tachycardia, that fast heart rate. So we would see this in both high-functioning anxiety as well as mania. Because remember, if you have anxiety, your heart rate's going to jump up, and for mania, just think maniac. Now with depression, we're not going to see this because depression, we have a depressed mood. We'd actually have a slower heart rate. Okay, last question for today's video coming right up. And if you can't get enough of these, then you can get way more by just clicking the link in the description below. All right, guys, it's that time again. Everyone's favorite, not really, worst topic, the bow tie. But let me make this simple for you. So first, the question's asking us to complete the diagram by simply dragging the choices to identify three things. Number one is the condition. Number two is the actions to address the condition. Basically, how are you going to save the client's life? And number three is the parameters to monitor for. Basically, how do you keep the client safe? So for the problem, let's look into the case study and find keywords that risk safety. So at the top of the case study, we see that the hospice nurse is caring for the client who is newly diagnosed with stage 4 pancreatic cancer. So let's click under tab 1 and see what we find. So tab 1, we see chemo and radiation for about 2 months. Now clicking over to tab number 2, duloxetine, remember, is given for dual use, both cancer and neuropathy. But this client is getting it because of the cancer. And they're also taking atenolol, which remember, atenolol is a beta blocker ending in LOL, so think 2 L's for 2 low vitals, heart rate and blood pressure. Now let's click over to tab number 3. The HCP states that the treatment was not working and recommended hospice. And the client states, I told my family and friends to live their life and don't come. I don't need them. I'll be okay. Okay, now hold your horses here. This is a huge NCLEX tip. The NCLEX will not simply cure your clients for you. If you see good signs, always think of the worst possible scenario. Now, the next thing is very concerning here. Take a look. Upset mood, but today the client has been cheerful and giving away their prized possession. That's a huge key term and a huge NCLEX tip right there. If the question states that the client has depression or a history of it, then giving away prized possessions is typically always a bad sign for worsening depression where the client slides into suicide. Now let's look under tab number 4 for the vital signs. Well, would you look at that? Everything looks stable. All right, now for the solution. Before looking at the options, based on our data findings, what do you think kills or harms this client first? Well, it has to be suicide because the entire case study stated all the key words. First, the client stated, "I told my family and friends to live their life and don't come, I don't need them, I'll be okay." But really the most concerning one is the upset mood, and the client has been cheerful all of a sudden, which is a sudden change. But really, the big key term is giving away prized possessions. So now let's look at the options. Option 1 is incorrect. For manic episodes, the client would go into mania, basically becoming a maniac with high energy. Now this is typically seen with bipolarism, where they cycle between high energy and low energy with depression. Now option 2 is correct. Suicidal thoughts. Again, the NCLEX is not simply going to cure your client for you. So if you see a client acting cheerful all of a sudden, well then this is a rapid change, noting a critical client. The key term that gives it away here is they're giving away their prized possessions, typically indicating the client is getting even more depressed, resulting in suicide. Now the last two options are incorrect, because in option 3, situational anxiety, there's no data that supports that the client has any type of anxiety like nervousness or even hyperventilation. And option 4 is incorrect because kleptomania is simply a mental disorder where the client is unable to resist the urge to steal, and there's no indication of stealing here. Now moving on to the actions to take. So again, before looking at the options, simply look at the data in the case study. Then think about actions to keep the client safe. So number 1, a one-on-one sitter would keep the client safe for any suicidal client. And number 2, directly asking if the client is suicidal or having a plan to kill themselves, the NCLEX wants you to be direct. Now let's look at the options here. So option 1 is incorrect. Delirium tremens is a negative effect after cutting off alcoholism, and there's no indication that the client is having any type of tremens or tremors. Now option 2 is correct. By simply being direct and asking the client if they're considering suicide, this is what the NCLEX wants you to do. So this is priority. Now option 3 is also correct. Therapeutic communication, really for any unstable client, but specifically for a client with suicide risk. Now the last two options are incorrect, and let me explain why. In option 4, this can be way too much too soon, causing further harm to the client who's already terminally ill. And in option 5, this one was a little bit close, but alprazolam is a benzodiazepine. Remember, those drugs ending in PAM and LAM to decrease anxiety. But again, there's no data in the nursing notes that supports any anxiety. Now moving on to the parameters to monitor for. Once again, before looking at the options, think about the data in the case study. What would you monitor to keep the client safe? Well, number 1, how they interact with family or even friends. And number 2, depression management. Now let's look at the options here. Option 1 is correct. Social connections are priority to monitor here. For example, the key term that the client gave away their prized possessions to their friends indicates a big red flag for suicide risk. Now the next two options are incorrect because in option 2, there's no indication the client is having anxiety at all. If that was the case, we would see nervousness, sweating, or even apprehension. And in option 3, all the vital signs are stable under tab number 4, so nothing's really out of order. Now option 4 is correct. Compliance with antidepressant medication should be of top priority. This is because the client is showing signs and symptoms of that worsening depression, with giving away of prized possessions and being of low mood. Now the last option is incorrect because once again, let the case study help you here. There's no data that shows kidneys or liver are having any trouble at all. Now if this was true, we would see either lab values or signs and symptoms that would indicate kidney or liver dysfunction. Wow, NGN questions are no joke, but you're doing great. Get access to way more NGN questions plus all of this. And you can sign up for free by simply clicking the link in the description below.